Good evening, everyone. We'll wait for a few more minutes to let others join. Am I audible?
Yes.
Okay. There's no echo, right? I'm joining from a new device, so I'm just checking. So, good evening, everyone. I'll just share my screen. Sorry for that glitch. Can you hear me now and can you see me?
Yes, ma'am.
Okay, I'll just share my screen. Can you see the presentation? Yeah, so
Yes, madam.
thank you. So welcome back to week 6, that is the 6th session for the NPTEL online course Drug Delivery Principles and Engineering, and we have been discussing the previous year assignments for a couple of weeks now. So let's begin with this session. Have you guys gone through the week 6 material? So some of you must have gone through it briefly. For others, I'll just give you a quick recap of what this week consisted. So we have been discussing about tissue engineering for the past 2 weeks, I guess, or 1 week, few lectures. And in tissue engineering, in the past week, we have seen that we can have whole organ replacement or part of the organ replacement, or we can just restore a function of a damaged organ through the principles of tissue engineering. And at the end of the last week, one case study with ECM proteins was discussed by the professor in the lectures. Moving on from tissue engineering, in this session we have moved on to drug delivery in tissue engineering, of why, since this complete module relates to drug delivery, so we'll also go through some concepts of how drug can be delivered during tissue engineering. So there are few instances where this becomes very important. For example, if you have transplanted an organ from one donor to another patient. So in that, when you have an organ, it's a pretty thick implant and it does not have its own blood vessels. So you need to administer certain growth factors for blood vessels to form in this new implant. Similarly, whenever you are putting a biomaterial, let's say you have put in a stainless steel rod in the knee replacement surgery, and here since it's a foreign material, it can attract bacteria, and that can lead to infection whenever it gets implanted into the patient's body. So to avoid that, we have to administer certain antibiotics with it. So this also is included in the drug delivery during tissue engineering. Similarly, whenever you're transplanting an organ from one human to another, there will be immune rejection because our immune system recognizes anything foreign, even a donated organ from another human, as a foreign material. So it will lead to an immune attack, and that will lead to your graft rejection. So to avoid that, we can give certain immunosuppressants along with this implant. So these are few instances where drug delivery becomes an important part in tissue engineering. And later on in the lectures, we have seen how there are different ways of delivering growth factors. For example, if you have your biomaterial, you can directly conjugate your whatever molecule your drug is. For example, it can be a growth factor or it can be an antibiotic. You can directly conjugate that with your biomaterial and then implant it into the patient's body. Or you can, there are few examples discussed in this week where you have something known as a heparin, and you first of all conjugate heparin to that biomaterial, and to this heparin you can then functionalize this heparin and then attach your growth factors to the same. So these are few ways. And next, the last few lectures in this week consist of implant associated infections. So this becomes important because most of the biomaterials which you are going to inject, which you are going to implant into the patient's body, the surface of these biomaterials attracts various bacteria, and then this leads to bacterial colonization on the surface of this implant, and that leads to a very severe infection inside the patient's body, and then that might lead to various problems, such as it might attack your own body. Then your body then launches an immune attack against this implanted biomaterial, and then that leads to severe problems. So the ultimate fate of this biomaterial which you have implanted can be a device failure as well. Then you have to completely replace that device, and if you keep on doing this again and again, that's not a good way to relieve the patient of the disease. So to avoid this, we'll look into what all ways are there to reduce this implant associated infections as well. As we solve this week's assignment, we might get few questions where we'll discuss more about these concepts. Is this clear? Shall we move ahead with the assignment?
Yes, madam.
Okay. Can you guys see the question? So I'll read out the first question. Which one of the following is incorrect about biofilms on implant surfaces? You can read through the options and take your time to answer. If anybody has the answer ready, you can volunteer as well. Just unmute your mic and let me know, because I can't see your raised hand since I'm in a slideshow mode. I don't see the other window.
To increase antibiotic interactions.
That is the third option. So one response says that the right answer is it increases antibiotic interaction. Okay. Anybody else wants to give it a try?
Yeah, 3. It increases antibiotic interaction.
Okay. Thank you for answering. So we have two responses. Any other answer? Okay, let's look at that. So yes, both of you were correct. The right answer is it increases antibiotic interaction. So these are the effects of biofilms, how biofilm then affects our host defense. So it does so by these many ways. First is it prevents antibody penetration to the bacterial surface. So what is a biofilm? Biofilm is just a film of your bacteria which colonizes on, let's say, your implant surface, and so whenever your bacteria is free floating, it's a separate entity, single bacteria, versus your biofilms. So whenever your bacteria is clustered in this biofilm, they get certain different properties, and then that is even more severe to treat compared to your single bacteria. So since it forms so it's usually a slimy layer, that is why it's. Anybody trying to say anything? Okay, so since your biofilm forms a layer over the implant, it prevents the antibody penetration to the bacterial surface. So whenever a bacteria resides in a biofilm, they start secreting certain proteins and certain polysaccharides to make a protective layer over themselves. And this, since your antibody is a pretty big molecule, it cannot penetrate to the bacteria inside the bacteria, and hence cannot act against this bacteria. So there your antibodies won't be able to have an effect. Similarly, it prevents macrophage bacteria interaction. Since macrophage is also a bigger cell compared to your bacterial size, it won't be able to penetrate this biofilm, and it won't be able to engulf this bacteria and then kill the bacteria. Similarly, it reduces leukocyte or neutrophil infiltration into this biofilm. Therefore, so neutrophils are your first immune cells which act against any foreign material, so they also won't be able to have an effect. Next, it enhances the virulence of bacteria, because so many bacteria are now acting in concert, meaning they are communicating with each other, and they have formed a very stronger force against your immune system. So they enhance each other's virulence. It becomes more difficult to treat this biofilm, and they then start sequestering bacteria specific ions and nutrients, meaning they will use your body's nutrients and take only what is necessary for their growth. Similarly, it prevents antibiotic interaction. Since it has formed a layer over your implant, your antibiotics won't be able to penetrate inside this biofilm, and as a result, they will prevent this antibiotic interaction. So the question is asking us which is incorrect about biofilms on implant surfaces. So the right option is it increases antibiotic interaction, which is actually incorrect because it decreases the antibiotic interaction. Am I clear?
Yes, madam.
Yeah, anybody has a doubt in this? Thank you. Okay, so we can move on to the next question. Next is, why are stents used in blood vessels for tissue engineering? We have to select two correct options, and there are several options listed out here. Just go through them. If you have read about what exactly are stents and why they are used in tissue engineering, you might be able to answer. Anybody can volunteer?
Option 3 and 4.
Okay, option 3 is 1, 2, 3. To open occlusions from vessels, and
4.
4. Okay, to bypass a blocked artery or vein. Okay, we'll wait for other responses. Thank you.
Option 3 and last, madam.
Option 3 and last, to increase diameter of blocked blood vessel, hence increasing fluid flow. Okay, that's another answer. Anyone else? Okay, let's see. So the right answer is option 3, that is to open occlusions from vessels, and the last option, that is to increase diameter of blocked blood vessel, hence increasing fluid flow. So the one who answered first, one of your options was right. Let's see what blood stents are. So if you've gone through the lecture material, I have just picked up the slide from the same lecture material. So your stents are this material, where this metallic material, where whenever you have a artery blockage, it happens because of this plaque formation inside your blood vessels. So if this plaque keeps on increasing, it creates a lot of pressure onto these arteries for to pass the blood. So the cells or organs which are at downstream of this plaque, meaning the right side of this plaque, if you can see my cursor, so they won't be getting enough oxygen, they won't be getting enough nutrients, and their waste will also be not cleared out because your blood vessel is not functioning properly. So what you can do is to remove this plaque, since these are very very small arteries, you can't inject anything else, which in this process you might damage these capillaries even more. So what you can do is you can insert this metallic stent inside, which has a balloon, and if you blow this balloon, which has a connection here, this will then push the plaque further, and this can also disintegrate this plaque, and then it can be washed off because of your blood flow. So this is what stents are used for. It is basically a support or filler material, and this is majorly used to remove occlusions from the vessels. So if you consider these options, why are stents used? It is used to open occlusions from vessels and to increase the diameter of blocked blood vessels, so that you can increase the fluid flow. Why option 4 is not correct? Because you don't bypass a blocked artery or vein using stents. There is a different procedure to do that. Since if there is a blockage which cannot be even repaired using the stents, then you bypass a blocked artery or vein. So for stents, the option 3 and last is correct. Did you get this? People have any doubt here? If not, I'll move on. So the next question is, which of the following methods would you use to prevent bacterial adherence on device? Pick two options. Rough surface, regular smooth, hydrophilic or hydrophobic. You guys can think over it and then let me know the answer if anybody has a response.
The last one, hydrophobic.
Last is hydrophobic surface. Okay, that is one option. You have to pick two options.
And rough surface.
Sorry, your voice is not clear. Can you please repeat?
Rough surface.
Okay, another option is rough surface. Okay. Anybody else has an answer?
Madam, regular smooth surface and hydrophilic surface.
Okay, so you're saying option 2 and 3. Okay, we'll wait for other responses. So I have two different answers. Anyone else wants to give it a try? Okay, let's look at
Regular smooth surface and hydrophilic surface.
Okay, thank you for answering. So another answer is option 2 and 3 again. Anybody else? Okay, let's look at the answers. So the last two people who answered were correct. The right answer is regular smooth surface and hydrophilic surface. So here we want to prevent the bacterial adherence on device. So these are the things, the points which you should consider when you are implanting any material inside. So whenever you have a rough surface, if your surface is having a lot of projections instead of a smooth surface, it has more surface area for the bacteria to adhere on that surface. So as a result, your rough surface will give more sites of adherence for the bacteria, but we want to prevent this bacterial adherence on the device. So in order to do that, first of all, you'll give a regular smooth surface so that it does not have many sites of attachment, so that it doesn't adhere, the bacteria doesn't adhere on the device. Next, since bacteria has a lot of proteins on its surface, these are mostly hydrophobic in nature, and as a result they will keep on looking for hydrophobic surfaces because they want to exclude the water. So in your body, where most of the fluid around is water, is hydrophilic in nature, your bacteria will quickly identify a hydrophobic surface and then get adhered on that device. So if you have a hydrophobic surface on your device, you are going to attract more bacteria. So to prevent that, you can then make your surface hydrophilic. So the two ways in which you can prevent bacterial adherence is you provide a regular smooth surface and you make the surface more hydrophilic. Is this making sense to the person who answered first? I'm sorry, I can't see your names.
Yeah, it's me, Sujata.
Yeah, thank you. Any doubt in this question? If not, I'll move ahead. So the next question is, which implant device has highest rate of infection, and we have to pick one option. So this is just a straightforward question where if you've gone through the lecture material, you might have read about this. Nothing conceptual here. Any response? Any attempt?
Heart assist device.
Okay, that's option 1, 2, 3, 4, 5. Fifth option, heart assisted devices. Okay. Anybody
Yes,
else?
ma'am. Art as devices.
Okay, thank you. I'll wait if others wants to answer. Okay, no one else. So both of you are correct. The right answer is heart assisted devices. So there was this table in one of the lectures where it talks about the magnitude of problem of device associated infections. In this you can see that the rate of infection is more for heart assisted devices, and these are the least used implants all in US. So this data is from US. So the right answer for this question is heart assisted devices. I don't believe anybody has doubt in this. There is nothing much to discuss here. So I'll move on to the next question. The next question is, what are the common approaches used to reduce implant associated infections? You have to choose two correct options. Any guesses?
One sterilization.
Okay.
And option 3 surface modification.
Okay, so you're saying option 1 and 3, that is sterilization, surface modification. Okay, anyone else? Thank you for answering. Yes?
Yes, ma'am. Option 1 and 3.
Okay, thank you. Option 1 and 3. Anyone has a different answer? No? Okay, let's look at the answers. So, yeah, you were correct. Whoever answered, all of you, I guess 2 responses. So, the right answer is sterilization surface modification. So, as we discussed, that this is a major problem where your implants can carry infections on its own whenever you are making the surgery, or they can get infected once implanted into the body. So, as we discussed in the last question as well, if you have rough surfaces or if you have hydrophobic surfaces, they provide more binding sites for the bacteria to adhere. So to avoid that, you can have surface modification, wherein you can make the surface more hydrophilic, make it more smooth, and also sterilization. So sterilization, as you might be knowing, is the process where you eliminate all living forms on the surface. So whenever you are implanting a device, let's say you have a titanium rod or a steel rod, you sterilize it completely with whatever suitable method is there. For example, it might be an autoclave. So you sterilize it and then you implant it into the patient's body. So these are just ways of minimizing the implant associated infections. Not necessary that doing this will guarantee that there will be no infections, but these are just precautions you can take while performing the surgery. So according to the question, the correct answer is sterilization and surface modification. Any doubts in this? Okay, then I'll move on towards the next question. So the next question is, which one of the following is not a feature of implant infection? Several options are listed out: adhesive bacterial colonization on the material, resistance to host defense mechanisms and antibiotics, transformation of non-pathogens or opportunistic to virulent organisms because of presence of biometal substratum, persistence of infection until removal of material, absence of tissue integration, tissue healing, presence of tissue cell damage and necrosis. So we have to identify a feature which of these options is not a feature of implant infection.
Tissue healing.
Okay, one response is tissue healing. Thank you. Anybody else?
Tissue healing.
Okay, thank you. So both responses are tissue healing. Anybody has another answer or would like to?
Tissue healing, madam.
Okay, thank you. Others? Okay, no other responses. Let's look at the answer. Yeah, so all of you were correct. Tissue healing is the right answer. So these are the features of implant infection, where first is adhesive bacterial colonization on the material. Whenever you have your implant, so first of all, the bacteria is going to, since if your surface is very much conducive to the bacteria, it's going to start residing there. More and more bacteria will join, and then they'll form a colony over there that will lead to biofilm formation. And as we discussed, biofilms are very resistant to host defense mechanisms and antibiotics. They will not let antibiotics or your antibodies penetrate inside this biofilm. As a result, none of your antibiotics won't have an effect. Also, during biofilm formation, your non-pathogens or non-pathogens might transform into the virulent organisms, because biomaterial is something very different than what is usually encountered by the bacteria into your body. So it might trigger some signaling pathways inside the bacteria, and it might lead to the formation of new molecules inside the bacteria. New genes might get transcribed and new proteins might be formed, which can impart virulence to this organism. So a pathogen which is not usually virulent inside your body might become virulent because of the presence of this biomaterial. So that is one feature of implant infection. And even if you keep on providing antibiotics, So for a while, you might see that the bacterial population has gone down. You might have recovered from it, but then it will keep on relapsing, because this is one other feature of implant infection, where persistence of infection until removal of material. So the last option you have left to save the patient from this infection is you have to completely remove the material. And there is absence of tissue integration, because you want your implant to be integrated with the tissue. Let's say you have done a knee replacement surgery on a patient, and you want that material to be integrated to the bone, to the patient's bone, but because of this biofilm presence, the bacteria will prevent this tissue integration, and it can lead to presence of tissue cell damage and necrosis, because since there's foreign material, there is bacteria, there is biofilm present, your immune cells will try getting rid of this bacteria, but because there is biofilm, it is not letting your immune cells to attack. Your immune system will think that we might need to launch a much stronger effect, much stronger attack, so it will keep on producing molecules to kill the bacteria, but then the bacteria is not getting affected. But since your implant, surrounding your implant, there are also normal tissues and normal cells, so they might get damaged because of your own body's immune system. So because of this, there might be tissue cell damage and necrosis. So these are the features of implant infection. So from these options, the only option that is not a feature of implant infection is tissue healing, because until and unless there is infection in the body, there is biofilm formation on your implant, it will not let the tissue heal properly. So that's the correct answer for this question. Am I making sense? So Dharma, if you're still there in the meeting, at the end of all the questions, I would again go through the first few questions. So maybe we can discuss it again at that time. So since we are in a flow, it might be repetition for other people. So I'll discuss it when we are done with the questions. Is that okay? Is Dharma present in this meeting? Okay, yeah. Sure. So let me quickly finish this assignment first. So I hope you guys are clear with this implant infection, and we can move on towards the next question. Next question is how biofilms inhibit host defense mechanisms pick up the false statement. So we have been discussing it for quite some minutes now, so I think you guys would be able to answer this. So we have to pick up the false statement.
Yeah, option 2, reducing the virulence of bacteria.
Okay, reducing virulence of bacteria and biofilms and making them susceptible to immune effectors. Okay, that is one response. Anybody else?
Yes, option 2, madam.
Okay, thank you. Others?
Option 2, ma'am.
Okay, thank you for answering. Anyone else has another answer? No? Okay, let's look at the answer. So yeah, all of you were correct. The right answer is reducing virulence of bacteria and biofilms and making them susceptible to immune effectors, which is actually incorrect, because biofilms might make the bacteria more virulent and they do not make them susceptible to immune effectors at all. So this is the false statement amongst the listed options here. Biofilms do not inhibit any immune effectors, or they do not reduce the virulence of the bacteria. On the other hand, they actually enhance the virulence of the bacteria, and they make the bacteria more resistant to the immune effectors. Any questions here? Okay, we'll move on towards the next question. So the next is, which of the following is an advantage of decellularized matrix? So we have to choose two correct options. Toxicity of detergents used, fragments of ECM triggers clotting cascade, the matrix does not trigger immune response, the network of natural ECM is suitable for growing cells, difficult to produce on large scale. So we have to select advantages of decellularized matrix. So this question again comes up from tissue engineering part. Yes?
Options 4 and 5.
Can you please repeat? Option?
3 and 4.
Okay, 3 and 4. The matrix does not trigger immune response and the network of natural ECM is suitable for growing cells. Anybody else wants to give it a try?
Option 3 and 4, madam.
Option 3 and 4. Okay, thank you. I'll wait if others want to answer. Okay, nobody else wants to give it a try. Okay, we'll discuss the answers. Yeah, both of you are correct. The right option is matrix does not trigger immune response and the network of natural ECM is suitable for growing cells. So we'll discuss about decellularization a bit. So whenever you have a donated organ and your patient needs an immediate transplant, so even if it's from a human body, even if the donated organ is from the human body, it can still it still leads to a lot of rejection because it's still a foreign material. So one way to avoid, to minimize this immune rejection, the graft rejection, is to decellularize the organ. So what you do, you just take the donated organ and you remove all its cells by giving it a detergent treatment. Since the cells present in the organ, the nucleic material, which might be DNA or RNA, and the proteins present, these are the things which lead to a higher, very stronger immune attack whenever transplanted to a different body. So what you can do is you first remove all these cells and you just have this ghost organ. Now by ghost organ I mean the only ECM is present in your organ, and then this is known as decellularizing the matrix. Now what you can do, you have this ECM based scaffold from the donated organ, which you can then place into or implant into the patient's body. Now because it has ECM, the patient's own cells will start repopulating this ECM scaffold, and then they'll form a shape of the organ which it was originally when it was donated. So now since the implant is having the patient's own cells, there are less chances that the implant might be rejected from the patient's body. So this is one way to avoid immune rejection. So the advantages of this system is the matrix does not trigger immune response and the network of natural ECM is suitable for growing cells. Is this concept clear? So that's why these two options are correct.
Yes, ma'am.
Thank you. If nobody has a doubt in this, we can move on towards the next question. So the next question is, which of the following is not an objective behind tissue engineering? We have to select two correct options. I'll give you guys some time to read through the options and let me know if you have an answer. Anybody? So basically the question is asking us what are the applications of tissue engineering. Whichever doesn't fit into this applications is the answer. Anybody wants to
And
give it a try?
the last one,
The last option you're saying, embedding cytokines.
yeah.
Okay, that is one option. Do you have any other option? Because we have, the question is asking us to select two options.
And third and last option.
Third is embed cells like neutrophils and macrophages in scaffolds to enhance the inflammatory profile of the damaged tissue. Okay. Anybody else?
Ma'am, the last option.
Last option. Okay. Do you have any other option to select?
No idea.
Okay, sure. We'll discuss. Thanks for answering. Others want to give it a try?
The first one,
The first is to generate new tissue to replace damaged tissue. Okay. Thank you. Sorry? I didn't quite catch that. Can you repeat? If anyone was trying to answer.
nothing.
Okay. So let's look at the answers. So the correct answers are option 3, that is embed cells like neutrophils and macrophages in scaffold to enhance the inflammatory profile of the damaged tissue. And the next correct option is the last, embedding cytokines like interleukin 1 beta and matrix metalloproteinase 13 to create more damage to the tissue. So most of you got the last option correct. So let's look at the applications of tissue engineering. So tissue engineering is used to generate whole tissue in vitro and then replace damaged tissues in patients, or it can generate part of the tissue in vitro and then replace these damaged portions in the patients, or you can put in scaffolds to regenerate damaged part of the tissue in vivo, like we discussed with the decellularized matrix, or it can mean adding support filler material like stents, or putting in a metal implant to support the function of the damaged tissue. So both of these options are incorrect because we do not use tissue engineering to enhance inflammatory profile of the damaged tissue. We don't want to check if there is inflammation. That is not what tissue engineering is used for. Also, we don't want to put in cytokines like interleukin and metalloproteinase to generate more damage to the tissue. That is not the aim of tissue engineering. All tissue engineering is done for is to enhance the function of a damaged part, damaged organ in your body, or to completely replace it. Is this making sense? If you read the rest of the options, those are the correct applications of tissue engineering: to generate new tissue meaning a new tissue to replace damaged tissue, to generate tissue in vitro which can be used to regenerate the damaged tissue, add support of filler material, and putting in scaffolds to help regenerate damaged tissue. Is this making sense?
Okay.
Yeah, thank you. Then if you guys have no more doubts in this question, we'll move on towards the last question of the session. So the last question is, consider that insulin releasing cells are embedded in a scaffold made of collagen. The rate of release from the scaffold is given by the equation which is displayed on the screen, and the dimensions of the scaffold are as follows: area is given, width is given. So in steady state, how much insulin will be released in 5 seconds? And we have to give our answer in millimoles. You guys can quickly solve this and let me know. I'll wait for you. Anyone wants to volunteer before we discuss the solution?
I think it's 11.
Okay.
2.2 into 5, it gives 11 millimole, madam.
Okay. Okay. Thank you for answering. Anybody else?
For 1 second, it reduces 2.2 millimole, madam.
Yes.
So we are into 5, so we will get 11 millimoles, madam.
Correct.
There is
correct.
nothing to
Right.
with area and with the.
Yes, yes. That is just given to confuse people. Even I was confused when I saw the question. So both of you have answered 11. Let's look at the solution. So typically for these numerical based questions, you'll have a range where your answer can fall in between this given range. If it's in this given range, it will be considered correct. So the right answer is 11 millimole, because so they've given, the question is telling us that there is a scaffold made of collagen and in which insulin releasing cells are embedded, and there is a certain rate of release rate at which insulin is released from the scaffold, which is 2.2 millimole per second. That is 2.2 millimoles of insulin is getting released per second. And then they have given us area and width of the scaffold, but the question also mentions that it's a steady state. What does a steady state mean? It means there's a constant rate. Steady state has reached, there's equilibrium, there's a constant rate at which insulin can be released. So irrespective of whatever is the area of your scaffold, whatever is the width of your scaffold, it will follow the same rate. So if you go by the question, same rate will be followed. So if in 1 second 2.2 millimoles is getting released, then in 5 seconds you just have to multiply with the rate and you'll get the answer of 11 millimole. Somebody just explained it before me, so thanks for doing that. Did others get it? There's nothing much to solve in this question.
I mean, examination also they used to give the range, madam.
Examination, I'm not sure if you'll be given a range. I think it's more for the examiner who is going to check your answers. I don't
Yes,
think
thank you.
you'll have a range. So for these questions, typically you won't have any negative marking. That's for sure, because for numericals, for all other questions you'll have negative marking if you mark the wrong option. Since most of the questions will be multiple choice questions, if you mark the wrong answer, your marks will be getting deducted apart from losing the marks for that question. For numerical based questions, you won't have negative marking, so you can give it a blank try. But if it falls in between this range, so then that's when it will be considered. But I don't think so you will be given the range of answers. I'll get back to you on this query in the next session. I'll just confirm it with the TAs. You
Totally, how
can.
many questions will be asked in the examination, madam?
Sorry.
Totally, how many questions will be asked in the examination?
That will depend on the course you have taken. I think the it depends on how many marks. So all the papers will be for 100 marks. So it might be distributed in between. There might be some numericals. There might be some multiple choice questions. There might be some single choice questions. Like your answer will have only one correct option, or your answers might have 2-3 correct options. So it depends on how the examiner has set the question paper. So but the final marks will be 100 marks.
Yes, thank you.
Yeah. So somebody had asked to go through all the first 5 questions. I'll just go through the assignment once more if anybody has joined late. So I'll quickly go through these. So the
Excuse
first,
me.
sorry?
Excuse me, ma'am.
Yes, please.
Actually, the exams are once in a year or twice in a year?
I think it's once in a year. So this course is there once per year, the drug delivery course. So you'll have the exam once per year. So if you guys have any questions which I'm not able to answer, you can post it on the forum. There's a question forum, if you guys might be knowing, where the other TAs associated with the course can answer you much better. Since we are discussing the previous year assignments, have you joined the course? Are you part of this course? You must be solving the recent assignments as well, right?
Yes.
Yeah. So you can post your questions on the forum as well. If not, I'll list down your queries. I'll get back to you in the next session.
Okay.
Yeah, but as far as I know, the exams will happen once per year, whenever the course is floated.
Is on system or OMR sheet, madam?
No, this will be online. Everything will be online. You would be asked to go to a center. There will be a specific NPTEL centers. So there'll be, yeah, you have to go to a center. You can, whenever you will be applying for that exam. So there is an option where after the, in between you will get a where you have to fill in the form, and you can give your preference of area around you. Whichever center is nearest you, you can select that. You have to go to that center, and then the test will be online.
Yes.
Just like your GATE or other exams.
Yes.
Yeah. So I'll just quickly go through the assignment. If anybody has any doubt, you can stop me at that point and let me know. So the first question was, which one of the following is incorrect about biofilms on implant surface? And the correct answer was, it increases antibiotic interaction, because biofilms actually decrease the antibiotic interaction, because biofilms is a slimy layer which forms over your implant because of sequestration of bacteria, and because the layer is pretty strong in nature, it will not let your antibiotics, it will not let your antibodies, it will not let your macrophages enter into the biofilm. As a result of it, it actually decreases antibiotic interaction. So the only option from this which is incorrect is it increases antibiotic interaction. So this PPT will be provided to you. Also, this session is getting recorded, so I'll be uploading it on YouTube, and you will get the link from the NPTEL team. You can again go through this video if you want. So I have listed out the different ways in which biofilms inhibit the host defense. So the next question was, why are stents used in blood vessels for tissue engineering? And the correct answer was, to open occlusions from vessels or to increase the diameter of blocked blood vessel, hence increasing fluid flow. So stents are this metallic material where you can insert them into the arteries that are blocked, and then it has a balloon which gets inflated. As a result of this, it will crush down this plaque which has accumulated here, which is creating pressure to the blood flow that can be removed. So your stents are basically used to open occlusions from this vessel. Occlusions is inhibition, the plaque formation, that can be removed from the vessels, and you can increase the diameter of the blocked blood vessel so that your blood flows properly, and your any cells, any organs at the downstream of that flow, if they're not getting enough oxygen, doing this can increase the blood flow to these organs. Next was, which of the following methods would you use to prevent bacterial adherence on device? And the correct answer was regular smooth surface and hydrophilic surface, because as we discussed, if you have a hydrophobic surface, your bacteria tends to get adhered more on the hydrophobic surface because of its hydrophobic proteins on its surface. Also, if you have a rough surface, you'll have more surface area and more sites of adhesion for the bacteria. So in order to prevent this bacterial adherence, you can make the surface smooth, and you can also make the surface more hydrophilic. Next was, which implant device has highest rate of infection? This was a pretty straightforward question. The answer was heart assisted devices. There's a table in the lecture material listing out the statistics from US. You can go through it. Next question was, what are the common approaches used to reduce implant associated infections? The correct answer was sterilization and surface modification. So both of these ways are used to reduce any infection, any bacteria which might be present even before doing your surgery. So surface modification we discussed, making the surface hydrophilic and making the surface smooth. Next question was, which one of the following is not a feature of implant infection? And it was tissue healing, because everything else is actually a feature of implant infection, and because your infection, because the presence of bacteria, the presence of biofilm on the implant, it will not let your tissue to be integrated, and it will actually cause more tissue damage and necrosis. So the right answer here was tissue healing, which is not a feature of implant infection. Next was, how biofilms inhibit host defense mechanism? Again, we have to pick up the false statement, and the correct answer was reducing virulence of the bacteria in biofilms and making them susceptible to immune effectors. This is the false statement, because in actual case, your biofilms increase the virulence of the bacteria and they make it resistant to these immune effectors, which means your immune cells. Next question was, which of the following is an advantage of decellularized matrix? The right answer was, matrix does not trigger immune response, and the network of natural ECM is suitable for growing cells. So this concept comes from donated organs which you have decellularized, remove all the cells, remove all nucleic material, removed all proteins, small molecules. You have this ECM scaffold, You put in the patient's own cells inside that, allow it to recellularize, and then implant it into the patient's body. So since it is from the patient's own body, it will not trigger immune response, and since it's natural ECM, it is much better for the cells to grow compared to a synthetic ECM. Next was, which of the following is not an objective behind tissue engineering? So the right answer was, embed cells like neutrophils and macrophages in scaffolds to enhance inflammatory profile of the damaged tissue, and embedding cytokines like interleukin and metalloproteinase to create more damage to the cell, more damage to the tissue, sorry. So this is not what tissue engineering is used for. You basically use tissue engineering to replace a damaged organ or to enhance the function of a damaged organ. And the last was a numerical, where we have given insulin releasing cells are embedded in scaffold made of collagen, and then we have given a rate of release and the dimension of the scaffold, and we have been asked at steady state how much insulin will be released in 5 seconds, which was pretty easy because since it's steady state, the rate of release of insulin will be constant. It will not depend on the dimensions of the scaffold, and the straightforward answer was 11 millimolar. Anybody has a doubt? I just quickly rushed through the assignment once more.
Yes, ma'am. It's okay, ma'am.
Okay. Anybody has a doubt in this session or in the previous session? If not, we
No,
can,
ma'am.
yeah, thank you. We can stop the meeting. Okay, shall I end it? See you guys in the next week. Swapna and Kristen, do you have any doubt or shall I end the session? Okay, so see you guys in the next week. Thank you. Bye bye.